Well, I can say in radio, we don't divide it. We look at just the general issue of health, and if it's policy related, we'll cover that. We've talked to local state lawmakers about what they're doing in the legislature regarding health care. And in terms of just stories, we're interested in things that, one, will inform people and educate them. Those are the kind of the priorities. We don't have time in radio. Our stories are relatively short, so we can't spend a lot of time getting into a lot of detail about things. And obviously with medical stories, if you talk to a doctor, if there are any doctors in the house, I know I saw Dr. Piazza earlier, but doctors have their own language. And so we have to make sure, because the only sense that we can focus our stories on is a sense of hearing in radio. So we've got to make sure people understand what we're talking about. So that means translating some of that medical jargon into something people can understand.
If you tell me that heart disease in dogs is rising, or there's some problem, I want to see some data, and I would also like to see a research study. If you want to make a point that's contrary to common wisdom, I would like to look at, back that up for me. And just as Chris said, it's the man bites dog story that is more intriguing to us than the common wisdom that, you know, if you eat too much sugar, you're going to gain weight. Well, you know, what if sugar led to weight loss, you know, and it wasn't sugar, it was all carbs or something, you know, like that.
I can tell you that, you know, for the Dr. Oz show, for example, their audience tends to swing female. They tend, if you've watched the Dr. Oz show, a couple of things that they're particularly keen on: weight loss, sex, and more energy. As an aside to diet, weight loss diet would be nutrition.
If you are using the web to offer more resources, so that as you expand your story a little bit, are you then giving them the resources so they can get more information?
I think we're all getting pretty smart with the web. And we actually will almost say that on our newscast, saying, look, we can't tell you everything, but there's a lot more for you, and we'll direct people through KXAN.com and provide separate information links in our stories. I almost prefer web publishing in a way, because I can get the fuller story out, not the abridged version.